Thank you for joining us today for this training video intended to help clinicians better understand the basic theory and application of SPIO products. This video will discuss the mechanism of action, how to choose a product for your patient, the use and application, functional changes to expect in your patients, as well as measuring, fitting, care, and cleaning of the products. My name is Karen Baker. I'm a licensed physical therapist and have been using SPIO products with my patients for over 14 years. During that time, I have worked and mentored with Nancy Hilton, one of the inventors and developers of SPIO products. Let's get started. SPIO compression orthoses were designed in 1996 for children with cerebral palsy. They are now used for a variety of diagnoses, including hypotonia, cerebral palsy, Down syndrome, muscular atrophy, athetosis, autism, sensory processing disorder, and many others. SPIO provides even, circumferential flexible compression that facilitates improvements in reduced hypertonus, sensory body awareness, dynamic stability and balance, movement control, and postural and muscle readiness. They act both on the neurophysiological and biomechanical systems. Active motor control requires effective sensory input to accurately plan and execute movements. Our ability to make movements that are accurate, properly timed, and with proper force depends critically on the sensory input that is present at all levels of the motor system. Deep pressure is a primary somatosensory input to the three-dimensional cortical body map, which underlies all movement control in body, muscle, soft tissue, and joint awareness. These brain maps are neuroplastic and responsive to any sensory input received. SPIO products provide even circumferential compression to deep pressure receptors, which are stimulated with even very small increments of movement. There does not appear to be any sensory receptor adaptation to this stimulation because even subtle movements change the orientation of pressure on the receptors, keeping them actively firing. This permits full-time wear of the orthosis with continued improved body awareness as long as the person is wearing it. As the person is better able to feel their body, especially their core musculature, they are more easily able to activate and grade combined muscle strategies for balance, active postural adjustments, active stability, and transitional movements. Recent studies investigating the impact of compression garments suggest increased precision and sensitivity at the joint where the compression item is applied. The compression may function as a filter to irrelevant mechanoreceptor information, allowing the nervous system to obtain enhanced sensory information related to proprioception. In persons with decreased muscle activity and hypotonia, there is often an observable waking up of muscle activation very soon after SPIO compression orthotics are put on. This is displayed in improved active balance and graded movement in many situations, and often increased spontaneous activity of the patient. In persons with poor motor control, instability can often cause a compensatory tension reaction in soft tissue or muscles. When this increased tension is related to poor body, muscle, or joint awareness, a reduction of tension is often seen after SPIO products are donned, demonstrated by freer, spontaneous movement, control, and balance. Sometimes movement is further restricted by fear. Patients have indicated that SPIO products make them feel more stable, safer, and more secure. This reaction has a neurologic impact on both the limbic system and the frontal lobe premotor cortex, which supports the person to trust their body more and more comfortably test the limits of their motor control. SPIO systems can also influence the biomechanical system. Through the work of Mary Massery and Paul Hodges, we have a better understanding of how the positive pressure of the abdominal and thoracic cavities is critical for core stability. The dynamic nature of achieving optimal control of balancing movement and stiffness to meet each unique task's requirements relies on the ability to generate, maintain, and regulate pressures within the trunk. This pressure, created by integrated activation of the trunk muscle team, impacts multiple systems. SPIO orthoses assist this biomechanical containment to improve the efficiency of the core muscle team externally. Balanced circumferential pressure also supports soft tissue and joint structures in a more neutral alignment. This permits more typical biomechanical chain reactions for active balance, centering, stabilizing, and grading of movement. The SPIO fabric was specifically chosen and designed to provide an even, multidirectional stretch and has very high rebound memory to support biomechanical containment. This unique combination allows the person to move in all directions with guided resistance. As the person moves away from midline, the fabric and design help guide them back to neutral physiologic alignment for improved balance. This supports both muscle strength and combined muscle strategies. The orthosis must fit tightly enough that it does not slip against the body, but rather maintains intimate fit on the skin during all movements. In summary, the dynamic nature of SPIO products allows for multiple repetitions throughout the day of more balanced, stable, and variable movement. Through its dynamic containment, it supports more challenging movements and balance, provides consistent and specific sensory input to assist with improved body awareness, important for feed forward and feed back, and makes movement freer, easier, and more motivating. To help select the right product for your patient, reflect on what your clinical reasoning has determined about their needs thus far. Identify the individual impairments and needs of your patient. What is the main functional change you are wanting to make? What has been helpful and effective during therapy? Is the support you provide more effective when given proximally or distally? Would your patient benefit from additional mechanical support? Our goal is to use the lowest level of support necessary to achieve the desired outcome. Once the product has been selected, observe the patient for 5 to 10 minutes and see what changes are evident. Every person responds differently to the input. Some patients respond immediately. Others take a few hours or a few days. Some are not a good match for these products. If you think more support would be beneficial, you can add another product or another layer of support and observe the reaction of the patient again. Remember, the product guide can be used during your assessment to support your decision-making. Some examples of functional changes observed with these orthoses are enhanced trunk, hip, and leg stability, improved postural control, balance, and coordination, increased shoulder and arm stability, improved gait, improved tactile exploration and precision. The Odyssey can be used when more support is needed at the spine. The back panel is heat moldable for a more intimate and custom fit. It can easily be remolded as the patient's needs change. For information on how to measure and fit your SPIO products, please click on this link. SPIO products should be washed at least every other day to ensure proper compression. Machine wash in warm or cold water using mild detergent and lay flat or hang to dry. Do not put the products in the dryer. When washing the TLSO, be sure the front panel is attached to the back panel to prevent the Velcro from snagging the Lycra. The fabric is not fire resistant, so the items are not recommended for use during sleep time. The devices can be worn all day, and there is no break-in period or recommended wearing schedule. They can be used and worn anywhere, in the home, at school, in a therapeutic environment, or doctor's office. SPIO products are not designed to replace therapy. They are intended to enhance the effects of therapy. Their use can provide assistance within the therapy session and beyond. The additional support of the SPIO product may allow you to try new skills or push the limits even more within your session. Continued wear throughout the week supports carryover into other activities and functional skills as your patient participates in the various tasks of their daily life. To hear more about what other OTs, PTs, speech therapists, and other clinicians have said about their experience with these products, click here. SPIO products continue to evolve. What has always held true is an open collaboration with families and patients to create a product that offers them support in their daily lives. Our goal is to support their needs and activities to make their lives more free.